In this video, I will be discussing with you why your period is late, the factors affecting your menstrual flow. Seeing this face for the first time, welcome. My name is Ifechukwu Prudenciana Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. My channel focuses on everything about health, especially family planning and reproductive health. If this is the type of content that you are interested in, please keep watching. And don't forget to follow my page, subscribe to my YouTube channel, and like, comment, and share. There are so many reasons why your menstrual flow is always late. Either it will come very early or very late, or it doesn't come at all. Number one is hormonal birth control, such as IUD, intrauterine device, pills, patches, implant like Jadel and Implanol. Many women are on hormonal birth control, and how it works is that it suppresses ovulation. And once ovulation is suppressed, in other words, menses will not occur. Many women on hormonal birth control don't usually experience what we call true menses. They usually have in-between bleeds, which they cannot usually differentiate between true menses and false menses. So when they are seeing their bleed, you think they are menstruating. They are not menstruating. Their bleeding usually occurs without time. Sometimes they will see it will flow for a day or 2 days and it will stop. Before 2 weeks again, it has come again and the same thing will happen. Sometimes they will bleed for a long time, beyond 7 days. So in other words, they will be confused of how to calculate and know which one is their real menses. So they don't usually have true menses, those on hormonal birth control. So it suppresses ovulation and that affects the menstruation and the menstrual cycle. The second factor here is breastfeeding. There is a hormone called prolactin. This prolactin plays an important role in the production of milk. Now, when the prolactin is high, it suppresses ovulation. Prolactin is being produced by activation and stimulation of the hypothalamus and the anterior pituitary gland. When anterior pituitary gland and hypothalamus is being stimulated to produce prolactin, automatically it will shut down the production of estrogen and progesterone. So whenever prolactin is high, estrogen and progesterone are inhibited. So this is usually common in women who are exclusively breastfeeding. That is why they don't normally see their menses, because they don't usually ovulate. When the prolactin is high, ovulation is inhibited. And when we are talking about breastfeeding, it doesn't usually mean that the woman will have a baby. Any reason that the prolactin level is high, any reason that a woman is lactating, either by a baby or by an adult, that the prolactin level is high, that can inhibit ovulation and the woman will not menstruate. So prolactin is a very important hormone in the production of breast milk. Another factor is stress. When we talk about stress, I mean emotional stress, mental stress, physical stress, psychological stress, any type of stress. Stress is not good for the body. When someone is stressed, the body releases two hormones called adrenaline and cortisol. These two hormones interact with menstruation. In other words, once these two hormones are released, the production of estrogen and progesterone, which are the female sex hormone, will be altered because it is the same hypothalamus and anterior pituitary gland that will still produce the adrenaline and cortisol. So once you are on stress, the brain will no longer have option than to stop the production of estrogen and progesterone and start producing cortisol and adrenaline. So stress is inevitable in human life, but try as much as possible to reduce the rate at which you expose yourself to stress. Because automatically, when you are stressed, like ill health, when someone is seriously sick, they usually have irregular menses. When you are passing through emotional traumas, when you are passing through psychological issues, menses don't usually come regularly. So try as much as possible as an individual, although it's inevitable, but try to reduce the rate at which you expose yourself to stress. The next factor is perimenopause. When one is approaching menopause, menses start to change. There will be changes in menstruation and menstrual cycle. 4 to 8 years before the actual menopause, the individual will start experiencing changes in her menstrual cycle. Sometimes it will be late, and sometimes it doesn't come at all until the actual menopause now starts and the menses will cease entirely. It's like a natural stage of life. You don't need to do anything. Once you're aging, there is nothing you can do about it. When someone is approaching age like 50 years of age, some even start their menopause earlier than that. So it's a natural stage in life. There's nothing you can do about it. It's just something that can occur in everybody. So menopause is one of the causes that affect menstrual cycle. The next factor is polycystic ovarian syndrome, PCOS. Irregular periods are the most common sign of PCOS. People with PCOS usually don't ovulate. Most of them menstruate only 4 to 6 times in a year. This is due to the increased level of male hormone, that is the androgen. Even when their period finally occurs, it comes with heavy flow. They usually have heavy flow when they are menstruating, and their cycles are usually anovulatory cycles, that is cycle without ovulation. So is one of the most common factors affecting menstrual cycle and menstruation. The next is fibroid. We all know that people with fibroid usually experience what we call in-between bleed. Sometimes after their menses, they will still be bleeding, or they will have a prolonged menstrual flow more than 7 days. That is why most of them come down with anemia. So the fibroid is one of the causes of irregular menstrual cycle. We have another factor called endometriosis. Endometriosis is a situation whereby we have a similar cells like that of the endometrium found outside the uterus, and they take the same pattern like the menstrual cycle. Whenever you are seeing your menstruation, they are also bleeding. So it's very difficult to find out which one is a menstrual flow and endometrial flow. is usually a very serious issue, and people with endometriosis usually experience pain, and most of the times their menstrual cycle are usually prolonged. They have a prolonged menstrual flow and prolonged menstrual cycle. So calculation is very difficult if you don't really know how to calculate your menstrual cycle. And because there is already an issue, the menstruation may no longer be regular. Another factor is weight loss. When there is excessive or rapid weight loss, it sends signal to the brain, and the part of the brain that is responsible for the production of female sex hormone, the estrogen and progesterone, will no longer be producing estrogen and progesterone because of the activities going on there. The rapid weight loss, maybe which is caused by either sickness or other things, will affect the production of sex hormone, and that will interact with menstruation. This is what we call hypothalamic amenorrhea. The brain will stop producing estrogen and progesterone due to the stress it's passing through. We have exercise, excessive exercise, as seen in athletes, dancers, and other people who are engaging in excessive exercise. They usually have irregular periods. Yes, that is one of the signs they usually have. We have medication. Example is blood thinning medication like aspirin, non-steroidal inflammatory drugs. We have antidepressants, antiepileptic, and chemotherapy. Especially when you have ovarian cancer, endometrial cancer, and cervical cancer. They are directly involved with the reproductive system, the ovary and the endometrium, the uterus. So definitely the production of estrogen and progesterone will be altered, and menses will be affected. Sometimes they don't even menstruate at all, especially those on chemotherapy. It affects menstruation badly, and is understandable. The next point is miscalculation. Probably you must have miscalculated your period, as some of us don't usually know how to calculate their menstrual cycle. I've seen people counting it with their fingers. You miscalculate it, and you'll be thinking and disturbing yourself. Am I pregnant? Do I have infection? Do I have this? Do I have that? Miscalculation. Learn how to calculate your menstrual cycle, so you'll be sure when actually you're expecting to see your menses. If you have not watched my video on how to calculate your menstrual cycle, go watch it. I will likely put the link up here. So miscalculation is one of the factors affecting menstruation. When people miscalculate their menstrual cycle, and they will be expecting to see it and they will not see it. The last but not the least is you could be pregnant. So go out there, have the test done, and come back. When you come back, we continue. If you found this useful and you would like to have more content like this, please give me a thumbs up, like, comment, and share. Please don't forget to follow my page, subscribe to my YouTube channel, and turn on your notification to notify you when I upload new videos. Until I see you again in my next video, please do take care of yourself and drink plenty of